talk about a condition that affects virtually every woman. It's called vaginal infections. Vaginal infections are common conditions that cause discomfort and disrupt the normal balance of microorganisms in the vagina. Several factors can contribute to the development of vaginal infections, and this includes bacteria, fungi, viruses, and other sources of irritation. There are several types of vaginal infections. Let's take a look at a few of them. Bacterial vaginosis is a common vaginal infection caused by an overgrowth of certain bacteria in the vagina. It is characterized by a shift in the normal balance of bacteria, with a decrease in beneficial lactobacilli and an increase in other bacteria. The exact cause of bacterial vaginosis is still unclear, but it's associated with factors such as multiple sexual partners, gouging, and hormonal changes. Symptoms of bacterial vaginosis may include a thin, grayish-white vaginal discharge with a fishy odor, itching, and irritation. Number 2 is candidiasis or yeast infections. These are caused by an overgrowth of the fungus Candida, most commonly Candida albicans in the vagina. Yeast infections can occur due to factors such as hormonal changes, antibiotic use, weakened immune system, or high blood sugar levels in individuals with diabetes mellitus. Symptoms of yeast infections may include thick, white, cottage cheese-like vaginal discharge, itching, burning vaginal sensation, and redness in the vaginal area. Trichomoniasis is a sexually transmitted infection caused by the parasite Trichomonas vaginalis. It's usually transmitted through sexual contact. Trichomoniasis can cause symptoms such as yellow-green, frothy vaginal discharge with a strong odor, itching, burning sensation, redness, and discomfort during sexual intercourse or urination. Both sexual partners need to be treated to prevent reinfections. And number 4 are the sexually transmitted infections or the STIs. Various other STIs can cause vaginal infections, including chlamydia trachomatis, Neisseria gonorrhea, herpes simplex virus, and the human papilloma virus, the HPV. These infections can be transmitted through sexual contact and may cause symptoms such as abnormal vaginal discharge, itching, burning, soreness, ulcers, or bumps in the genital area. Prompt diagnosis and treatment of STIs are crucial to prevent complications and further transmission. The causes and risk factors for vaginal infection varies depending on the specific type of infection. The exact cause of bacterial vaginosis is not fully understood, but factors such as a change in vaginal pH, sexual activity, gouging, and hormonal changes can contribute to his development. Candida overgrowth can occur due to factors such as antibiotic use, hormonal changes, for example during pregnancy or oral contraceptive use, a weakened immune system, uncontrolled diabetes, or a warm and moist environment. Trichomoniasis is caused by the parasite Trichomonas vaginalis and is transmitted through sexual contact. The sexually transmitted infections or STIs such as chlamydia, gonorrhea, herpes simplex virus, or human papilloma virus are transmitted through sexual contact with an infected partner. The symptoms of vaginal infection can vary depending on the specific type of infection. Common symptoms include abnormal vaginal discharge in color, consistency, and odor, itching or vaginal irritation, burning sensation during urination, pain or discomfort during sexual intercourse, redness, swelling, or soreness in the vaginal area. In the case of sexually transmitted infections, additional symptoms may include genital sores, ulcers, or bumps. Diagnosing vaginal infection typically involves a combination of methods. The healthcare provider will inquire about the symptoms, the sexual history, contraceptive use, previous infections, and any relevant medical conditions. A pelvic examination may be performed to assess the vaginal area for signs of infection such as redness, swelling or abnormal discharge. Vaginal swabs or urine samples may be collected to test for the presence of specific microorganisms such as bacteria, yeast, or parasites. Additional tests such as nucleic acid amplification tests might be conducted for STI screening. The treatment of vaginal infection depends on the specific type of infection. Bacterial vaginosis is usually treated with antibiotic medications such as metronidazole or clindamycin, taken orally or applied topically. Antifungal medications such as topical creams or oral tablets containing fluconazole are commonly used to treat yeast infections. Trichomoniasis is typically treated with oral antibiotics such as metronidazole or tinidazole, which are effective against the parasites. Treatment for sexually transmitted infection varies depending on the specific infection. It may involve antibiotics, antiviral medications, or other specific treatments targeting a particular sexually transmitted infections. To prevent vaginal infections and promote vaginal health, it's important to follow these self-care measures. Use of condoms correctly and consistently to reduce the risk of STIs. Douching can disrupt the natural balance of vaginal flora and increase the risk of infections. Cleaning the genital area with mild unscented soap and water is important. Avoid using harsh soaps, feminine hygiene products, or scented sprays that can irritate the vagina. Women are counseled to wear breathable underwear. You should allow the vagina breathe. Hence, opt for cotton underwears and avoid tight-fitting clothing that can trap moisture and promote bacterial or fungal growth. Women are also counseled to avoid prolonged exposure. Hence, changing out of wet swimsuits or sweaty exercise clothes promptly is important. Maintaining a balanced diet, managing stress levels, getting regular exercise, and ensuring adequate sleep to support a healthy immune system and overall well-being is equally important. As we conclude this segment, it's important to understand that vaginal infections are common conditions that can cause discomfort and disrupt the normal balance of microorganisms in the vagina. Understanding the different types of vaginal infections, their causes, symptoms, diagnosis and treatment options is essential for women's health. Prompt diagnosis and appropriate treatment can help alleviate symptoms, prevent complications, and restore vaginal health.